The Gauteng Premier's COVID-19 Advisory Committee, Professor Bruce Mellado, says that the third wave of infections in the province will only peak in the first week of next month. The province is already exceeding the numbers of infections reported at the peak of the first and second waves. It has more than 60% of all active cases in the country, and private and public hospitals are under severe strain. Yesterday, the Gauteng Health Department deployed medics from the Defence Force to assist at overwhelmed hospitals. Let's take this discussion further and looking into the severity really of the situation in the province when I joined via Zoom by Provincial spokesperson Vuyo Mhaga. Mr. Mhaga, it's always a pleasure to see you. Thank you very much for joining us here on SABC News this afternoon.
Good afternoon, Ms. Flo, as well as your viewers.
Let's talk about what's happening in Gauteng province. I mean, we heard, we hear from even the president was talking about it just earlier today that we're in a very serious situation in Gauteng province. Talk to us, give us a picture of really what it looks like.
Well, the situation is relatively bad in Gauteng, and I think the Premier correctly characterized it, that Gauteng is under fire. And I think maybe just to bring it to a proper perspective, the first wave or the highest number of the daily infection that we ever had in Gauteng was around 6,900. But on the 20th of June, we have surpassed that number. So the highest number ever to be recorded in Gauteng, it was on the 20th of June with 8,640. So obviously that tells you the level of the, how fast the virus is spreading within Gauteng, and obviously that leads to filling up of hospitals. Private hospital is extremely under pressure. We are equally under pressure as the public hospital, but we are actually working together and collaborating to make sure that we are able to respond to the residents of Gauteng and their health needs.
In the last hour, we were talking to the organization Gift of the Givers, the NGO, and they raised quite a few concerns about the situation in Gauteng, one of which, of course, is the closure of Charlotte Maxeke Hospital. I mean, we're already battling with hospital space, which, is set to only get worse, I'm assuming. What are the sort of short-term solutions? As I was thinking about this question to ask you, I thought about those beds that we used to have, the field hospitals. I mean, what's that? What's happening there? Is there no other contingency plan at this time? Because I do remember that we had that as quite a good, I suppose, at the time, contingency plan.
No, you remember, Osflo, part of the things that we have decided as a Gauteng provincial government was that instead of building field hospitals, let's actually increase the capacity of the healthcare beds in Gauteng.
Have we done so?
Have we done hospital using in alternative.
Yeah, but have we done so? I mean,
yes,
now that
let me give you exactly. Yes, let me give you where they are.
Yeah.
Yes, let me give you where they are. If you go to Provincial, you've got about 300 additional beds that they were never there before COVID. If you go to Jubilee, they've got 300. If you go to Bara, you've got 500. If you go to the Anglo Ashanti, the one that we're speaking about, we've got 171. George Mukari, we've got 300. Actually, we've doubled the number of the capacity of hospital beds that are there. Now, what we are doing, in addition to the 5,000 health personnel that we are actually providing, we are actually recruiting more, and obviously the additional aspect that was brought by the South African National Defence Force. So we have built the capacity of hospital, which is actually the legacy work that will even be there even post, the COVID-19 virus. It will be enjoyed by generations to come. So that was a very strategic decision to say, what do? Do we build more hospitals? Field hospital only to dismantle them at a later stage? Or do we actually use Nazareth as one field hospital, but we then continue to use different technologies that do exist now called alternative building technology to make sure that we increase the bed capacity of Gauteng? And we're taking that decision, and we are actually starting to benefit on that. Now, what we need to do is to make sure that we complement that with recruiting more healthcare personnel to make sure that they man those beds. That's what we call the functional beds. So the beds there physically? Yes, they are there. What do they need? They need an additional healthcare capacity, which the South African National Defence Force is coming through. The recruitment is continuing to to come through. As I've said to you, we have actually employed over 5,000 healthcare facility, healthcare workers during the COVID period, and we continue to increase that particular number.
Yeah. With the reinforcements from military doctors, obviously some questions around that. What is the strategy in that case in terms of obviously helping with the pandemic? Talk to us about the thinking and strategy there behind the reinforcements of having military doctors.
Well, you'll remember that the military came in the first wave, assisted us a great deal because obviously one of their expertise is around logistics. You'll know that they've got doctors, they've got nurses. So basically they are coming through. Yeah. Yesterday and today, they've been obviously being vaccinated to make sure obviously themselves they get safe. By tomorrow and going forward, they'll be deployed first at Barra and across all our hospitals in the province. But as I'm saying, it's not only that. Closer to that, parallel to that, we continue to recruit healthcare workers to make sure that we man those beds.
All right, Mr. Mhaga, thank you very much for speaking to us this afternoon here on SABC News. Appreciate your time.